Once you get to the gates, and by seeing the gates from the beginning, you will see that the place is bushy, the grass is everywhere, and there is not even roads to pass into that place. You have to manage yourself to get into the main place. And that place, by seeing, once you get there, seeing that it's a place that harbor a lot of mosquitoes, keep a lot of mosquitoes, and a lot of stagnant water in that place. Once you have been getting bite with the mosquito, it's not every mosquito that causes malaria. That's what we call Haemophilus mosquito. That is a female one. So there is an infected one that once they bite you, you will know that yes, you have become a victim. There is a one that even if they bite you, you are not going to get that bite. And those mosquitoes, they give birth in every single, let's say, minutes and hours. Once the place is comfortable for them, they give birth all the time. Even if you kill them, if you didn't clean that place, they will still give birth again, and they will still affect you. And it starts with like headache, hotness of body, weakness. It leads some people to even vomiting, and it leads to some people to even lose blood, like children especially.
If somebody been affected by malaria, you will normally go to hospital on our own, and you have to pay some money, whether if you go to pharmacy or primary health care or any clinic. You have to register with them, you have to buy their card, pay for consultation, then whatever they treat you, you have to pay for it.
Malaria fever normally comes with hotness of the body and body pains. If there's no money for hospital, when the malaria comes, we give the children paracetamol. If it doesn't work, we'll tell their fathers. Then when they have money, they take them to the hospital where they give them treatment for malaria. If eventually they don't have money, we just give them the paracetamol and pray that God will provide money for them, or we'll pray that the child will get better. Before the coming of chats, we honestly faced a lot of challenges concerning typhoid and malaria, because there's no time we'd wake up without 4 or 5 children having malaria or typhoid.
Actually, before the coming of chat, there have been passing through a lot, having like shortage of blood, anemia due to mosquito bites and other things, due to malaria, and having typhoid and other things due to the contaminated water and the food that they normally use to feed.
Honestly, the time we normally face malaria more is when the rainy season is about to begin. We're always scared because today you hear of malaria in this house, tomorrow it's in the other house, and sometimes all the children in the area would be sick with malaria. And when the malaria comes, you start hearing there's no blood. Anyone that has mosquito nets normally use it. Those that don't have, they use medicine for mosquitoes, but it usually causes catarrh for me.
As we all know, life has not been that easy with people around and entirely in the country for everyone. Talk more of the IDP camp, which they are being pushed from one place to another. The truth is, giving someone something that is not going to pay, especially medication, is a very, very good something. Most of them, we all know that they cannot afford all those medications. They have been having some series of issues like malaria, typhoid, which normally is to lead some of their children and their adults to death. And with the coming of the child, it really helped them. So these free drugs makes them to be coming around whenever they have some issues like headache, stomach pain, hotness of body. They always come around for checkup to know their health, because when there was no those drugs, they normally used to stay at home.
We've experienced a lot of change. If we say there's no change, we are not being honest with ourselves. We've experienced change with a lot of sick people and even pregnant women as well. We thank God we've experienced some changes since we started using the drugs.
We normally tested them malaria positive, high level of typhoid before charge came in. And once charge came in, the first week they were much, the second week they were much. But once we get like 1 month with the treatment, testing and treatment, we discover that the numbers has reduced. The way they come to the hospital reduced. The number of people that we normally used to get having like 2+Es and high typhoid reduced.
May God continue to bless everybody that is contributing to this. May God continue to bless the sponsors. May God continue to increase them, and the health workers and the doctors. May God continue to bless you people and keep us together. Thank you, thank you, thank you.
The process, it was a little bit difficult from the beginning. We do have issue of network at time, but with the help of the group, they do help us. Whenever we have network issue, we call them, they solve the issue immediately. The card, it really helps us to know who has registered and who has not registered.